So the first thing is I want to talk about our approach. So best value is a big philosophy. It's a big concept. There's a lot of theories. But when you peel it back, and I met Dr. Dean about 10 years ago, and he walked into a room and he came in with a Hawaiian shirt and a straw hat. I was sitting in a suit and tie. I think it was August, and it was about 103 degrees. I'm like, all right, this guy's already smarter than me. He's dressed better. We spent about 45 minutes together, and I looked around, and I got what he was saying, and I understood it. I'm like, but I don't understand the practical application of best value. I understand the philosophy. I understand the theory. It all sounds great, but you're going to have to prove it to me. So the very first thing we did in our first introduction to best value was actually during a very critical time. It was during a contract salvage process. So if you are a vendor or you have vendors, you know it's an uncomfortable position to be in when you have to salvage a contract you did not negotiate, a contract you did not bid on, a contract you did not try to deliver the services of. So brought in from the outside, sat down arm in arm with Dr. Dean and his team, and we said how we're going to approach this. The very first thing he said to me is you're going to have to learn what best value is. You're going to have to learn how we've been successful. Take out of your mind the fact that it came out of the construction industry. It doesn't matter. It's an approach that you're able to take and use in any business. Here are the successes. Here's how we've done it. Here's how it continues to evolve. I said, okay, I'm open to it. So me and a few team members met with Dr. Dean and some of his key people, and they gave us a crash course on best value. They gave us a thought on things that we could use to salvage this contract. It wasn't a consultant and a vendor and a client. It was how do you take those three people, those three parties working together, how do you give them the tools they need to be successful, and how do you get them each as separate entities to buy into the goal, the common goal, things that we want to accomplish together, and how do you work towards that end result? And the one thing that I took away from it, the things that we did at Canon that we learned, there are very good tools within the best value philosophy that became standards in our organization. So a couple of case studies, and this will get into why things are different. So this is a large hospital system, and this is the results. So the impact here was we modernized their print environment, reduce cost, increase security, improve patient experience. Now you may say, how does a vendor increase patient experience? Because I said that when they said this is one of our goals. I'm like, well, wait, we're providing hardware, software, people, break fix, 24/7 disaster recovery, and I had to change my mindset around it. Like, yeah, but everything you do allows us to be more impactful to our patients. If I'm not worrying about all these things working, I'm spending time with my patients. So we were able to carve out metrics specific to increasing patient experience. And it's something that we've adapted and now we do for all of our healthcare clients. It's a goal of ours. What can we do to help improve patient experience? On the other side, we saved $3.8 million, which was critical. We had a device reduction of 34% and a support model 24/7, 365. This assessment took 4 months. 4 months. And it took 4 months for a number of different reasons. There were a lot of monsters. We had multiple healthcare systems, different practices, with different operating licenses, with different people in charge. And they all had differences of opinion. So in our governance model, we said you need a representative from all these places. If you don't, we're not moving forward. It's a dead issue because we're never going to be successful. And you also have to understand standardization may not be the right way to go here. Each hospital has a different core principle. They have a different way of admitting patients. They have a different way of closing out and using an electronic medical system. It's different. So let's have these conversations. So we are able to go in and we did this full discovery. It took 4 months, but that's okay. We've now been working with them for 6 years. So a 4-month investment, doing it right up front, has allowed us to have a healthy business. We've hit all the goals they asked us to hit. Customer satisfaction is at an all-time high. And they did a video case study for us, which is, as a vendor, that's a hard thing to get somebody to do. It's really difficult. They did it, and they did it proudly. We still talk to each representative. Now, they've changed over the 6 years, but the framework and the governance model is never about a person. It's never about an individual person. It's about that position and who's in it and how they're going to contribute to the program. So we still have representation. That healthcare system is now coming together. They're going to operate under one license. they're going to be changing and standardizing their IT platform. And guess who had a seat at the table? We did. That never would have happened 6 years ago. We would have found out about it as they went to implement and created a disaster. We were a consultant to them. Think about that. Now, these are really, really sharp people. They are experts in what they do. But they respect us, and they came to us and said, you did this the right way. You've kept the communication going. You've delivered results. You've always been there. We have this project. We want you to sit on the table. That to me, as a vendor and service provider, ultimate compliment. This is a large university. The original state here, 1,232 devices, 12.7 million prints or impressions, 34.5% of volume on their multifunctional devices. So right there you could say, wait, you're spending all this money for this giant machine, you're only doing 34%. Certainly not getting a good ROI on that. And they were spending a little over $1 million a year. We came in, did a full assessment, made our recommendations, set some key metrics, and we reduced it to 264 devices, 10.8 million impressions per year. 93% of volume now goes to the MFDs, which is their lowest per impression cost on campus, and they're spending $681,000. So this is the trifecta. We had a financial save. We made them more productive. Number one, we taught them that when you hit file print and you don't pick up the paper, it never prints unless you release it. So you're not paying for that. When you hit that to the single function printer, you're spending about 8, 12 cents a page, depending on what toner you're buying, and you're spending 0.002 on our device. Oh, by the way, did you know you could scan that and have it in your email? You could send it out. You don't have to make 10 copies and hand them out. You can do all these different things. So we made them more productive. And then finally, from a sustainability perspective, you could see we reduced their volume. So those are things that are never coming back. Cost avoidance, more sustainable. The devices we put in were all ENERGY STAR compliant and operating at a kilowatt level at a much better rate. So we give that report to their School of Sustainability and have regular meetings with them. But finally, the thing that I think makes this a successful case study is they're one of our best references. Again, excellent compliment. It's a good program goal. We set them together. We achieved them. And now they tell people about us. That's outstanding for me. And the last one is an international finance institution. Here's their original state. And let me see who gets the, this is odd. 7,487 devices, 86 million impressions, 80-20 duplex ratio. Here it is today. 1,159 devices, 95 million impressions, 6238. Now, we got them to 2.3 million in save. What do you think is weird on this slide that's different than the others? Mm-hmm. Yep. Yeah. So it tells me, so our average uptime is close to 99%. The two things that are different here, you're on it, they actually printed more. They actually printed more. Our goal, we come in and say, we want you to print less. They said, why? We're a finance, we're not printing less. That's the least of our concern. Are you crazy? No. And their duplex ratio, sustainability metric, got worse. Inevitably, this got worse. And they said, we don't care. We don't even know why you measure that. Don't show us that. That's not important to us. We're different. We're not worried about that. They did like the $2.3 million in cost savings, but you know what they told us their number one goal was? Productivity. 75% of what they want to know, how are you making our folks more productive? Sustainability, cost savings, we got a ton of money. Make us more productive. Give us better technology, better tools, help us do the job. That's what we focus on. So every engagement that you're going to go into is going to be a little different as a service provider. The best value tools are flexible enough to take with you. It's a matter of how you are able to bring them to your organization, implement them, keep them going, get other people on board, because you can't do it alone. I can't do it alone. I've had many people come through this conference. I have coworkers here today. They keep getting educated, and this is how we grow the best value philosophy within a giant organization.
If you enjoyed this video, make sure to hit the thumbs up button and subscribe to our channel for more content. If you have any questions about the best value approach or for Dr. Dean, leave them in the comment section below and we'll get to them in a later video. Thanks. We'll see you next time.